Obviously, half of our patients are women, but most importantly, they also give birth to their children, which means their share is probably more than half of the population. And the consequences of mother's health, not only during pregnancy, even afterwards, taking care of the baby and family, is critical, really. In general, it's recommended for women to breastfeed babies for at least 6 months because of benefits of mother's milk, nutritional value and immunological value. Also, the bonding that's formed between mother and baby. There is some evidence to show the decreased risk of developing autism in patients who have been breastfed. So this is, in general, the right way to go. But the question about breastfeeding during taking the medications while the mother is taking the anti-epileptic medications, again, based on the evidence, it seems to be beneficial because potential and theoretical side effect, which is being exposed to anti-epileptic drugs, is much less than the benefits. Babies have been exposed to medications while they are in the womb at much higher level. In fact, the serum level of anti-epileptic drugs in baby and mother are the same. But in milk, breast milk, the amount of medication is much less. For example, for Lamictal, it's a little higher. For some medications, it's less. But there is no evidence to show that there is any harm in doing that. In fact, it has been studied, the role of the normal development of these babies are no different than those who are not breastfed. And IQ in 6 years, in fact, might be even higher in babies who have been breastfed while their mothers were taking anti-epileptic drugs. There are a few caveats that obviously we have to take care of. For example, after delivery, the level of the medication will go up. For some medications, more than others, because of obvious changes in mother's physiology, weight loss, decreased interstitial space, change in protein binding, kidney turnover. So there is a need for some lowering of the dose of the medication. In some cases, that can be critical. For example, there are examples of withdrawal seizure if you suddenly stop, if you don't breastfeed the baby, because they would suddenly stop getting the medication. In case of benzodiazepines, there are cases of withdrawal seizure. Even with Lamictal, there is a case that if you suddenly stop, the level in the milk is so low that they may have withdrawal seizure. Putting all the evidence, pros and cons together, there is no harm in breastfeeding in breast milk while the mother is taking anti-epileptic drugs. There are some advantages to it, as I mentioned, in terms of IQ and social bonding and behavioral aspects. It's important to know that regardless of what anti-epileptic drug a mother is taking, the recommendation that they'd better continue breastfeeding or start breastfeeding and continue at least for 6 months is still valid. There is no difference in the type of medication that they're taking. However, there are some differences. For example, medication that's most commonly used in epilepsy in women with epilepsy during pregnancy, Lamictal, would be excreted in the milk more than other medications, but still it's much less than the amount baby was exposed in the womb. But it might have some practical consequences. For example, after delivery, the level of Lamictal in mother's serum and milk may go a little too high, and therefore they have to watch the baby for signs of sedation or breathing pattern. But it doesn't mean that they have to stop breastfeeding, but instead we have to check the level and gradually lower the medication dose. And the same thing about other medications as far as we know, because we have to keep in mind that we don't have experience with every anti-epileptic drug during pregnancy. Our data is limited to a few that are more commonly used. but as far as we know, all those rules about breastfeeding and all the recommendations regarding continuing treatment applies to all old generation or newer generation drugs.